Hi, my name's Rosie. I'm one of the therapists at the Michael Palin Centre. We're making this short video today to chat to you about our online assessments. So during lockdown, we've been doing all of our assessments online, usually by Skype or by Zoom. And parents often have a few questions about that, so hopefully this video will answer some of those questions. Now, one thing that we often get asked is whether the content is the same, and it is. So everything that we do in our face-to-face sessions, we do in our online sessions too. Sometimes we have to be a bit creative, particularly with our younger children, but all the information that we end up with is exactly the same. Now, for our assessment sessions, we do two different sessions. So one will be with the child and one will be with parents. So one thing to consider is that you will need, if these sessions are happening on the same day, which sometimes they do at the same time, then you'll need two separate devices. One device in one room with you and another device in another room with your child. Now, sometimes these will happen on different days, in which case you will only need one device. That's often a good option for our preschool children, because then it means that one of you is available to help support them and to help support them engage with the therapist and to keep their attention as best as possible. We know that for some children it's a bit more difficult for them to communicate over Skype, and that's okay. Our therapists can deal with that. They can observe you playing with your child and they get a lot of information that way too. So we can make the assessments work and make you available to support your child if that's needed. Now, another thing that might happen during your session, because you're at home, is that there might be some distractions. So particularly if there are other children in the house, if there are other siblings around, sometimes things just happen that are unavoidable, that you can't plan, and you'll be a bit distracted. So we would say try and minimize these where possible, but we understand if this happens and it's okay. Your therapist will help you deal with it, whatever it may be on the day. Now, as your child will be in a separate room on a different device, it might be that they have some computer problems or something happens with their connection, and it's fine for them to just come and get you and for you to help them out with their computer too. We're quite flexible and just make the sessions work the best way that we can. So before the session, you'll receive an email from one of our admin team, and this will contain some assessments for you to fill in, maybe for your child to fill in depending on their age. Importantly, this will also contain the Skype address of the therapist that you're going to meet and the date and time of your appointment. So if you add the therapist before your appointment, you can make contact with them and it just makes things run a lot smoother on the day. So what the sessions contain, and this will be the same as a face-to-face session. So for the child session, the therapist just wants to get to know them a little bit, get to know about their interests, how they're getting on at school and at home, and we'll be talking to them about their talking to, how they feel about stammering and whether they want any help. There might be a couple more forms for them to fill in during this session, and the therapist will make a short video of them talking in conversation and reading a couple of pages of a book or looking through some pictures. Now, during the parent session, the therapist will ask you lots of questions about many different aspects of your child's life, and during this session they're really trying to get a good picture of your child so that any plan that they come up with will be a really good fit for them. So for these sessions that take place on the same day, the child therapist and the parent therapist will have a chat together once all the information has been collected and come up with a plan. On that same day, the therapist will feedback that plan to you. So depending on the age of the child therapist might have a chat with them and see how the child thinks the plan works for them, and if they have any questions, they might talk to them a bit about stammering too. And the parent therapist will talk you through the plan. They will let you know what happened in the child assessment and give you a bit of feedback about that. And they'll answer any questions that you have around stammering, give you some information about stammering, and really bring together everything that they've learned throughout the assessment session. So that's our assessment sessions in a nutshell. If you do still have any concerns or you just want to chat some things through a bit further, you can phone the centre and talk to a therapist here. But we look forward to welcoming you and seeing you at an assessment soon.